Hey my humans, welcome to my channel. My name is Monica and today I want to discuss the 5 things I wish I knew about preceptorship. So just to let you know, I'm currently hired at a telemetry unit at a hospital, a pretty well-known hospital, and it is crazy. I wrote down some notes so that I don't forget anything, so excuse me if you see me keep looking down at my book. So number 1, feeling overwhelmed. That is inevitable. It's gonna eat you inside. Well, I think many of you may expect that, and I expected that going in, but really going through the feeling overwhelmed was insane. There's just so many things being thrown at you that you have to soak up like a sponge in like what felt like 10 seconds. But it's okay. I tell myself this every time. Everybody has to go through it. So feeling overwhelmed is okay. It's normal, it's expected, and like I said, it's inevitable. Okay, number 2 is be honest with your preceptor. Okay, I can't express that enough. Be completely transparent with your preceptor. I was lucky to have a very good preceptor, I would say so myself. Very kind, very patient, and so I was able to have an open line of communication with him. Whenever I felt uncomfortable, I said, can I put him to the side, away from the patient, obviously, say, hey, I never done this before. Can you help me? Or before I do a task on my own, can I tell you what I'm going to do before I do it? And if there's anything any constructive criticism or any advice prior to doing it, I'm more than welcoming. Number 3, learn to use all the equipment on the unit. Once again, learn to use all the equipment on the unit. So I say this because I had like 2 incidents where, wasn't life-threatening, thank God, but where I didn't know how to use something. There was, I had a patient being admitted, and I was rolling the bed, like la 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 la, and then I didn't know how to lock the bed, and the patient's daughter was with me. And so I'm like struggling, and then a fellow nurse caught on to the fact that I was struggling. He comes and he just like locks the bed, and the patient's family goes, "Is that my nurse?" Like regarding me. And he goes, "Yeah, she's very good." I'm like, thank you, because she was really like, if this girl does not know how to put the brakes on a bed, how is this like little thing gonna take care of my mother? I mean, I'm assuming that's what she said, like was thinking, but yeah. Also, be able to locate all of your equipment. Where do you find an IV pump? Where do you find an O2 nozzle? How do you work the O2 nozzle? Nasal cannula, rebreather mask, all these vital things, know where to find them. Know how to use them, most importantly, because you don't want to be found in a situation where your patient's life is at risk and you don't know what you're doing. Okay, so take this time, this preceptorship time, to soak up all the information possible. Have a notebook, have a little paper, jot down some things that you weren't able to remember. Come in early the next day, walk around, find, locate. It's very, very helpful. Number 4 is make yourself available to others for any learning opportunity. And by that I mean if there's someone on your unit that has to put an IV or has to draw some blood or needs an EKG or just simply finger sticks, ask them, hey, can I help you? Can I use this moment to learn? Can I practice my IVs? Can I put in a Foley, and take that as a learning opportunity. This time is for you, and I'm sure everybody's more than welcoming to having some help. Okay, when I offered my help, they're like, yes, and do this one, and I have this other patient, and I'm like, but I'm like, I need to learn, so I'm gonna say yes to many opportunities. The narcotic count, check the fridge, check the crash cart, like, make yourself available. You're going to need it. Number 5 is don't compare yourself to others. Okay, so everybody around you is most likely way more experienced than you on that unit. So remember that. Tell yourself we all began from where you're at and they became who they are now. So don't compare yourself to somebody's pace, to somebody's charting or note taking or report. Take that as a learning opportunity and, soak it like a sponge. Whatever it is that you admire of that person or that you wish you had from that person, jot it down, make a note of it, talk to that person, say, how is it that you do X and Y, and how can you teach me? Can you help me? Don't compare yourself to anybody else, okay? We all have our own path. We all have our own little journey that we have to take. And so just live in the moment, admire the process, soak in the process, be in that moment, and you'll be fine. I tell myself all the time that everybody started from zero, where I feel like I'm at sometimes. And it's okay. Thanks everybody for watching, and I hope this information was helpful to you. If you have any questions, if there's any other things regarding preceptorship or being a nurse in general, feel free to comment down below and let me know what you think. Yeah. So thank you guys for watching, and I hope to see y'all next time.